Morning, Dr. Steve Gortmaker from our School of Public Health, and Sarah Bleich, who will follow him. Both are professors on our faculty, Sarah in Health Policy Management, and Stephen SBS. That keeps changing all the time, but he's been a tremendous colleague for many years working on sugar and obesity and related fields. So Steve's going to start off.
Thank you, Walt, and thanks everybody for sticking around after the fire drill. And thanks for Norwich for inviting me. I'm going to talk about the cost-effectiveness analysis of sugar sweetened beverage excise taxes. I'm basically going to talk about what's happening in the United States. There's plenty to talk about. I have no conflicts to disclose. And thanks so much to all my funders, our team. I mean, really, this is a big team effort. Some of the folks are here. Our project, our Choices project, I'll give you a little background. We've been trying to identify strategies that will reduce population levels of obesity, improve population health, and reduce health disparities. We want to compare the health benefits and cost of different obesity treatment, prevention strategies. And part of that is a study of sugary beverages. I think the most important thing is if we want to reduce population obesity levels, we need to move beyond simply asking what's effective and also consider cost of interventions and their likely impact on population health. As part of this, we've thus examined more than 40 obesity programs and policies high on the national agenda in the United States. We've conducted systematic reviews. This is over many years, about 130,000 peer-reviewed publications for evidence of effect. We've estimated the cost of interventions following standard costing guidelines. And we've developed a simulation model to project the population impact of interventions and their cost effectiveness over 10 years. We can go out further, but we've been doing 10 years with a model which we say uses big data, and I'll talk about that a bit in just a minute. The basic idea here is pretty simple. We're interested in interventions that are lower cost with better outcomes, ideally, even higher cost with the better outcomes. We certainly don't want to be up in this sector. Higher cost, worse outcomes. Sometimes I think the poster child here would be the U.S. healthcare system. We seem to do worse than just about any other country of the same economic state, but we spend a lot of money. We've created a simulation model. We call it a micro simulation model. It's like a SimCity model. And with that, we've created accurate state-level estimates of obesity prevalence for adults, which corrects for self-report bias, and for children. We've projected with this model that more than half of today's children will have obesity when they're adults. Yes, obesity is still growing in the United States. It's getting worse, and this is where we're headed. So this model gives us, I think, a better understanding of how obesity prevalence is likely to play out in the U.S. in the future with and without interventions to improve dietary intake, physical activity, and reduce excess weight gain. This chart shows us this projection for kids. This is for kids in the United States, where we're headed without any interventions. This is, again, based on our simulation model. It was published in the New England Journal last fall. This is where we're headed over the next 30 years for young kids in the U.S. without intervention. The other thing about our simulation model is it helps us to understand what it's going to look like in the future. So we take the effects of interventions, the population reach of interventions or their cost, and we project then the population impact of these interventions, the comparative cost and cost effectiveness of the interventions, and the future impact on racial, ethnic, and income disparities. So it's a lot of stuff. Here's how the model works and the kind of data we use. Again, it's like a SimCity model, a microsimulation model. We start out, we select 1 million people based on census data. We have all the US Census data down to the census tract level in the United States. We then factor in population growth and BMI trends, and so we make use of all the BRFS trends over time, again corrected for self-report bias, all the NHANES data in the United States. We take into account dietary intake patterns off of NHANES, smoking patterns, and again, the body growth over time. We've stitched together life course trajectories of weight and height change over the life course. It's actually not that hard to predict these things, particularly height. Like for this population, I can tell you what your height's going to be 5-10 years from now. It's not very complicated. Weight's a little more complicated, but on average in the United States, we gain about 1 pound a year. That's for kids and adults, and that's still going on. It's very predictable. Read our New England Journal paper, and you'll have a good sense of that. We then project where this is going in terms of future obesity rates, obesity status over time, and then outcomes like obesity rates, healthcare costs associated with obesity. On average, individuals with obesity have substantially higher healthcare costs. For kids, just a little bit higher. For adults, substantially higher. And then higher mortality and rates of chronic disease. So we predict those into the future. For a simulation model, we could go out many years, but we've decided only to go out 10 years. As a demographer, I feel a lot more confident in predicting what's going to happen over 10 years, particularly in terms of healthcare cost, than I would about going over 30 or 50 years. So we just go out 10 years in our predictions. So that's the basic model that we've developed. So let's talk about estimating the future impact of a sugar-sweetened beverage excise tax of $0.01 per ounce implemented nationally at the state level. This is basically the tax they introduced in Berkeley, California, and we'll get later into talking about other taxes. We've modeled out the impact over time of about 35 different taxes across different states and cities across the United States. And again, why focus on sugary beverages? Well, because that's where the sugar is. You know, that's where a lot of it is. You've seen this chart before multiple times in this meeting. Let's go through the logic of the assumptions that we make, the parameters that go into the model, and the uncertainty in these parameters. Well, the basic idea behind a sugar-sweetened beverage excise tax is you implement with this tax and you raise the price of a sugar-sweetened beverage. I mean, that's what appears on the price label when you see it in the store. It's an excise tax that's generally paid by the distributor. And so a consumer will see an increase of about 16% in the price of that. Well, the assumption here is that the tax will be fully passed on to consumers. That's basically what happened in Mexico. There's a whole literature on this in the economics world saying, in generally, these things are passed through. But in the short run, some of them won't be passed through completely. You know, small stores, stuff's been on the shelf for a year, the price hasn't changed, stuff like that. Once this price increases, there's a whole literature on the impact of, well, if you raise the price of a good, will people buy less? And this has been studied in economics for a long time, and in general, the answer is, yeah, you raise the price, people buy less. That's this demand curve. And the elasticity that people have found here, which is the estimate of this, is about minus 1.2. So about a 20% reduction in purchases. That's what people have found for sugar-sweetened beverages. People are ready to move away from this stuff. It's an interesting question we'll come back to, and maybe Sarah can talk about this a bit. What's happening in the real world as these taxes are implemented? And I think the evidence from Mexico is that would this happen there? I mean, the elasticity was about played out about as expected, and we'll see how it happens in the United States. But that's that assumption. Then we've already reviewed this issue. If you reduce your consumption of sugary beverages, how will that impact your excess weight gain? Again, a beautiful double-blind study from the Netherlands where kids were given non-calorically sweetened beverages, and they didn't gain as much weight as the kids who were. And so we made what we think are reasonable assumptions there about the impact on weight change. I think it's important to think about how this model likely plays out. With the way we see a sugary beverage tax playing out is the main thing that's going to happen is it like will slow the rise of excess weight gain. It's not going to reverse stuff, but it'll slow that excess rise across the population. We have a whole bunch of metrics that we've estimated. Here are three that particularly our stakeholders, our advisory groups, liked as we've presented and worked with groups in states and cities across the United States. Cases of childhood obesity and cases of adult obesity prevented in a particular year.